Thank you for coming today. I am Yulong Li from Miami University. I'm looking forward to talk with you today about a highly contested, complex problem that is climate change is threatening Ohio children's health. The last year, 2020, was the hottest year on record. Atmospheric carbon dioxide levels are the highest they have been in at least 3.5 million years. In many parts of the world, people are facing multiple climate-related impacts, such as surf drought, flooding, air pollution, and water scarcity, that leaves their children vulnerable to malnutrition and disease. Almost every child on Earth is exposed to at least one of these climate and environmental hazards. Without urgent actions, this number will keep going up. First of all, I'm going to present the problems that is brought by climate change in Ohio. I have listed the most served three. So the first I will introduce to you is the hotter and more frequent heat waves. As the slide shows, in Ohio Valley, there has been a warming trend since 1970. It has increased by as much as 2 degrees. Children are at great risk of getting sick or even dying due to extreme heat. According to the U.S. Global Change Research Program, the potential life-threatening effects of extreme heat, including dehydration, hypothermia, and fever. Kids who live in cities are in double jeopardy. Heat waves will be even more intense in urban areas because there is asphalt, pavement, and buildings that radiate heat, while it has just limited cooling green space. The next I will share with you is about the air quality. There is a picture of Columbus area. As you can see, the city has been covered by exhausted gases. Air pollutants from burning fossil fuels in power plants and motor vehicles drive global climate change, while also directly harming health. Children are particularly vulnerable to respiratory harms that are caused by poor air quality. According to the American Lung Association's 2019 State of the Air report, in Ohio, about 1 in 12 children have asthma. Let's move on now. I'll show you the Ohio River. It looks very dirty. The water was light yellow, and there might be some rubbish floating in the river. That is what I will introduce to you is water contamination. Heavy rains will wash agricultural fertilizer into our rivers and lakes, especially when coupled with warmer average water temperatures. This creates conditions in which harmful algal blooms thrive. They are threatening our water supply. Children are especially susceptible to illness caused by harmful algal blooms, including nausea, vomiting, diarrhea, rashes, pneumonia, and liver damage. So, before we get into the solutions, I would like to introduce a study to you. This is from the American Academy of Pediatrics, a United States medical organization. This organization conducted an exploratory study. This study exposed more than 250 families in a pediatric clinic to climate and health counseling and served their baseline understanding of climate health harms and their receptivity to this counseling and how this counseling influenced their intention to engage in mitigation actions. So as the result shows that none of the families expressed dissatisfaction with counseling. The majority, while appreciative, showed signs of knowledge gain and demonstrated increased likelihood to support clean energy and to decrease their carbon footprint. The responses across different political identities were generally similar. So we all have intention to engage in mitigation actions, so let's see what we can do. The first solution is about local, national, and international policies and strategies. That is, rapidly reduce greenhouse gas emissions, ensure preparedness for extreme weather events, and sustainable plan. Let's start with reduce greenhouse gas emissions. The national emissions reduction standards should be adopted for both carbon and methane pollution, but political sea changes have stalled both federal limits on electric sector carbon pollution and on methane emissions coming from oil and gas operations. Ohio should be a leader in the absence of federal action and put its own standards in place. The next is to ensure preparedness for extreme weather. Disasters such as floods, devastating storms, and tornadoes pose risks to children's physical and mental health. The children should receive special attention in disaster preparedness planning. Also involves surges in the need for pediatric care in the aftermath of natural disasters. About the sustainable and renewable policy, it should include electricity generating systems, accessible transportation, plant-based food, and equitable access to green spaces. It helps improve the lives of children and families. So, have examined the first solution, I would now like to talk about the second solution. The second solution is about educating. To be more specific, communities, including professionals and non-professionals of all ages, about how to advocate individually and collectively and work with children to raise awareness and respond to the climate crisis. So, about the general public. Public can learn about the impact of climate change on child health through letters to the editor and community engagement. And finally, I would like to finish up the discussion with a shocking estimation from WHO. Climate change is expected to cause approximately 250,000 additional deaths per year between 2030, and 2050. By 2050, climate change will aggravate existing health problems, and populations that are most affected by climate-related diseases will also be at greater risk in the future. In addition, there will be 95,000 deaths due to childhood undernutrition. We should pay more attention, and children are especially vulnerable to extreme weather and other consequences of climate change. Smart policies can prevent further climate change and also reduce its effects. So, the littlest Ohioans are kept safe today and in the future. Thank you so much for your interest and attention.